Greetings, everyone. My name is DJ Wells, and you've tuned into our weekly conversation on those things that are of interest to us and of concern to us as we wrestle with this new normal that is the COVID-19 pandemic. So often we're faced with new challenges and new concerns. And so we've been spending these last several weeks talking with experts who can help us navigate various elements of the COVID-19 pandemic and the stressors and the new normal that we're wrestling with during this uncertain and unusual and unprecedented time. Today we've got a wonderful conversation to share with you. As always, Dr. Mensah is joining us, and with us today also is Dr. Patricia Perez. Dr. Perez is a faculty member at the Chicago School of Psychology and international psychology professor there. She's also a longtime advocate and expert when it relates to attending to the needs of children with special needs. And so we're gonna have a conversation with her and with Dr. Mensah as it relates to how do we attend to those special needs children at a time when we're wrestling with all of this uncertainty, when we're in stay at home and shelter in place orders and those types of things. You didn't come here to hear me talk about it. You came here to listen to Dr. Perez and Dr. Mensah share some information. And so I'm going to hand this off to them. As we always do, we invite you to ask questions of our panelists today. We're going to let Dr. Mensah and Dr. Perez have a conversation for a half hour, 35, 45 minutes, and share with you some of the things that they feel are most important. And while they're doing that, we encourage you to type some questions using, there at the bottom of your screen, you should be able to call up the Q&A function. And if you call that up, you can type in your questions. And in about 35, 45 minutes, I'll come back into the conversation and begin to share with Dr. Mensah and Dr. Perez those questions that you've been asking. And so without any further ado, Dr. Mensah, if you'd like to get us started on this conversation.
Thank you, Mr. Wells. Dr. Perez, we're extremely pleased to have you joining us today. And
Thank you.
There are some personal reasons we're extremely happy for that, which will remain between you, me, Mr. Wells, relative to our academic origins and commonalities. But having said that, Dr. Perez, tell me, what kind of motivated you to move in this direction, your chosen field? Share a little bit with us on that whole process.
All right, thank you so much. Before I answer that question, Dr. Mensah, I'd like to thank you personally and Mensah Medical, and also you, Dr. Wells, for inviting me to just share a little bit about this topic, which is very personal to me. So first of all, I'm a parent of a child with special needs, and also a professional. So even before we had our third child, Luke, we had two other kids who are within the typical range of development. And my husband and I, who's also a child development specialist, this was our area of expertise. So I was doing this type of work for about 20 years, prior or actually 15 years. And then we had our child. And so my perspective on understanding children with special needs, their families, support systems, really comes from two perspectives: the parent perspective and then the professional perspective, and hoping that both of them collaborate in the best interests of the child and the family.
That's why we're so excited to have you today, because you bring two perspectives that are very, very key. The side that helps and the side that feels the pain. Mm-hmm. And that is what is missing so often with many practitioners. On the other hand, there are quite a few practitioners who are who they are because they also share that commonality. They had a child with special needs.
Yes.
So this is why we're so excited to have you today, because you bring a truly human side to this whole issue, and in terms of how to cope, how to work with, where to go, and support that's out there. So please, doctor, share with us, what
Oh
are
my
some of your
goodness.
having been a parent or being a parent of a child with special needs, and now applying what it is you've learned. When we were talking before
Yeah.
about some of the roads you've been on and how you would approach individuals when you were just a practitioner, then when you became a parent, things kind of changed a little bit. Would you
Yes.
kind of share that with us, please?
Okay, so I'll talk from the professional side because that was my entree into working with children with special needs and their families as an early interventionist. So my role in my early 20s as an intern in a child development degree program, the Erickson Institute in Chicago, was for me to go out into families in their homes for children under 3 years old to provide them child development services. But what I gathered as a professional, I picked up on those cues, those verbal and actually nonverbal cues was the biggest thing, that I realized that they did not want me to tell them what to do. They wanted someone to hear them, okay? So hear them, and I only got it as a parent. I mean, I got it as a professional, but as a parent now with a child with special needs, when, and this is the human piece of it, which I've shared with many professionals, but you also have to realize a child with special needs for many parents is that brings about a grieving process for the child that they hope they had or they thought they were going to have, especially for those special needs like autism, that you may not outwardly see that special need, but once you engage with that child and the family, you can see the family's faces and things like that, you get a sense that there's not something not quite right. And so there's that human side of many families feeling, and parents feeling like there is some sort of loss. Okay, so there's the feelings of loss, feelings of what could I have done to prevent this? Is my child going to fit in? On the professional side, we want to see the child progress in their developmental milestones. However, from the professional side, you may not understand that emotional piece that we experience that might prevent, regardless of your level of education, to prevent us to actually follow those directions. And so I've had professionals come into my home to do this, as I have done in other people's homes. And that perspective is so different, where professionals who had come into my home when Luke was under 3 would say, wow, we've never had parents like you who have this child development background. This type of having a child with special needs doesn't affect certain type of people. It happens to everybody. So those type of comments, it was really, really interesting. So that's just like one example of really understanding the dynamic of what us as parents are going through, and also trying to understand, like, we want our child to succeed, but there are some things that we know, and we're looking to the professional to help us, but starting there in that recognition of, we wouldn't have wanted this. We love our child. We wouldn't have wanted this child to have all this pain and suffering potentially in us, but can you please be kind to us? I think that is really, really important to build that trusting relationship and collaboration. I could talk a lot more about that, but I don't know if that makes sense.
It makes tremendous sense, because what you're able to really do is to share that pain, that grieving process, which many practitioners really can't do. It's easy to go to somebody and they sit down and they say, well, on this scale, your child is this, and on that scale, they're this and this and this, and so forth and so forth. And then, here you go. And forgive me, I'm not talking about all practitioners here.
Right, yeah.
Come across the feeling that, there was an automaton that you were dealing with, and there's some generalized construct, but wait, this is my baby. This is my child. They're unique, they're different. And something you mentioned, again, when we were talking previously, talking about what your child can do as opposed to
Yes.
what not do.
Yes.
As doctors, we oftentimes focus on, okay, we want to correct, and I know I'm totally guilty of this. We want to fix what's problematic with your child. Tell me what your child can't do. Is there speech and language delay? Is
Yeah.
there issue with auditory processing, visual processing, da da da? And by the time you've gone through that dynamic, sometimes it can leave the human piece wanting. You told
Right.
me, doctor, that you're going to work on those things that my child can't do, and that's very important. But can I share with you what it is my child can do? What about that piece? I'd like you to talk more about that.
Yeah, I mean, in my own clinical training in counseling psychology with a minor in multicultural counseling, we were trained in that model. I mean, and it's not bad, it's not whatever. We were trained to use particular screeners, particular assessments within a developmental framework, use all of these type of testings, but no one ever, and there's all these benchmarks, whether it's in school, whether it's seeing a healthcare provider, whether you're going to see a therapist, all social worker, school psychologist, all of these things. However, what I realized as a parent going to these IEP meetings or individualized education plan meetings to prepare for the educational plan for your child moving forward, right? It involves an entire team of people like PT, OTs, all of these people based on the diagnosis. What I've noticed as a parent going to these meetings and not as a professional, and that's when I sort of had to say it as an advocate, like we advocate for our children, that stop talking. I mean, sorry if there are any professionals out there, but I'm just giving them a very honest view of what I said, because I could hear everyone's like, well, your child is below the 40 percentile in this area in speech and language. Your child is 20% and now is at this. So the whole entire 1 hour conversation around the table with all the specialists were, your child can't.
Mhm.
That was it. Your child can't, based on these assessments, based on the best practices, based on all of this, right? So one time, and that sort of turned the course, and he was around 4. I said to the team, I go, thank you so much for all of your comments. However, what can my child do? From a
Mhm.
developmental standpoint, we're thinking that a child can develop rapidly, quite rapidly, from 0 to 8. Okay, that becomes based on brain development research and things like that can happen, and obviously they continue to develop, right? The frontal lobe and all of these things that happen. However, that is the child development window. So I said to the group, and I was not trying to be too cheeky, but I did say, I said, well, if we believe in a developmental trajectory and also the potential of every child, then please tell me what they can do. And so that's usually the number one strategy as a consultant, that I tell and give advice to parents and educators. That's the number one question to ask, because that piece of information can actually help in translating what they like and what they do and what they can do to another area that they can't do. So I don't know if I could share an example of that.
Please,
Okay,
absolutely.
okay. So an example of that. So for example, our son Luke loves, like in our household, we have singers. Okay, we have singers, and part of the autism spectrum diagnosis is language, right? Expressive language and comprehension and social engagement and interaction and overall communication. So what I found really interesting is that I knew at the time what he can do and what he's interested in. He likes music, he likes math, right? He likes these type of things. So what do? So I encouraged our 2 older kids to invite him to sing a song, okay? And to record it so they could see he's looking, right? Eye contact too, for some kids, it's hard for eye contact. So he was able to look in the camera, practice that almost like looking at a person, and then building up those skills. And so he actually says more words when he sings, right? That's how we started with the language, than without that strategy.
Hmm. Interesting. Interesting. Now I want to take you to something a little bit different. That same strategy applied to someone who wasn't your child.
Okay.
Okay. How did that shift and change your practice in terms of how you dealt with patients? What was give me an example, give us an example of, shall we say, a before to after conversion with somebody who
Okay.
wasn't after your
Okay.
child?
Okay. So, I mean, some of the clients that I've seen, they were young. So they were under 3, okay, in the very, very early stages, going to their homes. So I've seen children who were diagnosed with Down syndrome. They had a trach, here. Like, I mean, and they would have a lot of feeding tubes and things like that. Obviously, the developmental screeners and all the things, the milestones for their ages don't even adjusted, don't really apply, okay? So what I typically do with a client going into the home or meeting a family for the first time is we build some rapport, okay? So I tell me about your child, okay? So by that picture, I get a sense of what's going on in the family, what they see, how they see their child, right? How they perceive themselves as parents, what they're in that conversation. I also ask, what do you want for your child? What are your hopes and your dreams for your child? And so all of that then, so the initial question gives me the baseline. Then the hopes and dreams then are the outcomes, where they want to see their child. So many of them say, I want them to be self-sufficient. I want them to be on their own. I want them to talk. I want them to be able to eat on their own. Okay. So I discuss some of those areas. I think in my head as a practitioner, what they're talking about. So if they want to eat, that's oral motor, that's nutrition, those type of things, right? Which could be hard for them. Then I say, okay, well, what can they do right now? Okay, what can they do based on their oral motor skills? And so they'll say, well, they can open their mouth. I go, great. What else can they do? It's like, oh, they really like peas, or they really like this. Okay, so then we have a sense, right? We have a sense of what they like to do. So I never say, like, wow, you didn't try this. Well, at this age, this is what should be happening. No, I start for where the family is at. It's a from the ground up process. The parent is the expert. The caregiver is the expert. They're the ones who know their child. I don't know their child. I'm just an advocate and a supporter and a cheerleader for that. In all that conversation, then our next step will be small, okay? And it's in collaboration with the parents. So for example, if I recommend for gross motor activity, like, I would like for the child to play with a ball. Okay, so that description of playing with a ball is quite broad. Like, you could throw the ball, you could roll the ball, you could do all of these things. I go, okay, so typically I would have a ball with me. I could roll it a little bit, and then maybe the child doesn't have those gross motor skills. We'll do hand over hand and roll the ball with them. All of those are considered successes in our eyes as a parent with special needs, because it gives us a way with some guidance and support that, wow, this could actually happen. It may not be based on the expectation of what we think playing with a ball is, but then that is part of my role as a consultant or a child development specialist to highlight the fact that, yes, it is. With this population and where your child is at, to reach the potential you hope for them is really crucial.
I think that's an excellent, excellent starting point. So in a way, what you do in terms of philosophy is very similar to what we do in terms of an individualized approach.
Yes.
This kind of takes the rubber stamp edge of so many paradigms of treatment, where, well, this is what we standardly do for a child who's in the spectrum. This is what we standardly do for a child who has, this disorder or that disorder. By starting with what it is that the child can do, you've already started seeing the parameters differently than the other approach. That is just
yeah,
absolutely
and the switch to, and if I can be so bold to say that, in addition to that approach, which is strength-based, gives onus and power and voice to the family and the primary caregivers. If I may be so bold to say that, I don't think it's just okay, I'm the specialist, you do this, you do that, based on science. It's a holistic approach. So whatever the family believes is the core value of their family and the hopes and dreams for their child is given the fact that all around the world, a child with special needs may not be received with open arms. I need to hear that context too, because it assists me in the guidance of that. So it's mind, spirit, body. It's everything, mind, spirit, body, like the whole, all of that, and whatever the client or the family deems as important. I'm not here to be judging, unless obviously within this country, it's it's something against the law. But that's typically not the case. It's more maybe cultural practices or things, sometimes we don't really think about like spirituality or religion or any of like those conversations based on some Western training is not something we talk about. However, or traditions passed down from your grandparents or something like that. But in many cultures, I'm originally from the Philippines, many cultures, a lot of the practices were dictated by our elders. And so it's really important to get that sense of what's going on.
Communal context, so important.
Yes.
And you're right, it is something that we don't talk enough about. We don't familiarize ourselves enough. As doctors in certain fields, we've got X amount of time, even if it's say an hour, we're spending more time trying to figure out what's wrong with the child than more so than including what's right. But the cultural context is very key. We once had a patient, and I sat there listening for a great deal of time, and his mother was telling me that he began to have certain spiritual experiences that the initial doctor thought was a bipolar or schizophrenic phenomenon. And in my mind, I was thinking, well, then it does kind of sound like it, it might be. But then she said, Dr. Mensah, where we come from, and we come from this part of the world, where we come from, that's a common thing for our children, our teenagers, as they grow to experience. It's actually encouraged. And at that moment, Dr. Perez, I sat down and I paused and I said, this is huge, because what it says is it really puts into question, wait a minute, what a previous diagnosis was may not be accurate, even close to being accurate at all. Because what we're seeing is that this is normal in their background. That's normal in their culture. And, obviously the United States is a multicultural, multi-ethnic, multi-dimensional, fabric here. And a lot of what it is that we do as practitioners really needs to be reassessed and perhaps sometimes re-examined, because what we're looking at here is we need to ask more questions. Yet, what can they do? And what does our family value? What is it that we do as a group? So I was watching, sometimes I have these insomniac moments like many of us do. And I was watching a program on Netflix or something. And in that program, they had a very, very interesting situation where when you meet in the first episode, a young lady who seems to be a real, how do I want to put it, nag to her boyfriend. She's a very elitist young lady. She doesn't seem to have a whole lot of empathy, yet she claims she loves him. And he passes away and they're still kind of connecting through virtual programming. And 4 episodes later, she is taking care of this young man's niece, one-on-one, alone. And we find out that they're at her home and her family was invited into this process. And their family was just the most biting, arrogant, abusive, verbally abusive, but within a humorous context kind of a situation, which really I just sat back as a viewer saying, that's really appalling, but now I understand why she has been the way she was for the last 3 episodes.
Right.
The family dynamic, the family structure gives you great insight into that person. And that is really in their development. So, absolutely, we see where it's so important to really start to ask the questions, who are you as a family, as a dynamic, as a culture? And now putting that child within that context. Because it makes a big difference then in terms of what can you do and is it important to that family?
Right. And there's so much more to be said here, knowing that there's huge stigma. Even apart from COVID and being a shelter in place, which is a whole nother challenge and raising in anxiety and stress, that there's stigma. Okay. So there's stigma and just having, people might say, unless you have a child with special needs. And I remember working with young children and parents saying to me in my early 20s, well, you don't know what it's like to be a parent because you don't have children. And I did say, well, yeah, I actually do. You're right. I don't know your experience, but please help me understand what that experience is, right? So I didn't say, oh no, I totally understand. So if when professionals say, oh, I totally understand what you're going through, that's not accurate, because you don't know what we're going through. First of all, there's stigma every single day. Parents and families, even in COVID, wondering all the things that we've actually worked towards. Like, for example, our child, Luke, who is on the spectrum, autism spectrum, all the things we have worked towards, like having him have a routine going to a restaurant. There was a hope for this year for us to get him on an airplane for the first time. He's 11. Talking to other people, greeting them, all of these things now are done virtually, right? And so it's now set us all back. And then, of course, people saying to us, oh, this must be really hard for you. You know, how do you even take care of someone like that? And then just knowing, not only are we isolated in this time, also the programming for our child, which isn't, I mean, typical children who are typically developing are also having a hard time with education and programming and all of this. You can only imagine what it's like for families with children with special needs. So it's really, I mean, there's all of that piece too, of the stigma, and professionals realizing that to be part of our circle, you know, and I love my friends dearly. I don't know if any of them are on this call. But sometimes it really is hard for us to, and we're not looking for a therapist, or it's someone to listen to us, to understand, like, we're not saying, oh, woe is us that we're, you know, we have a child like this, but we want you to understand that we're doing the best that we can. Yeah, right? We're doing the best that we can, given the resources, given the fact of where we're at right now, and to show some empathy in that.
And empathy, that's a very important point, and sharing that experience. You know, our staff at Mensah Medical, our clinic, most of the time we receive an introductory phone call from a prospective patient. There's usually about 15 or 20 minutes just listening to the history alone.
Yeah.
And what we tend to see, and now we understand more so, is that that person is really saying, I want to share with you who my child is, who my loved one is,
Yes.
and I want you to have some level of empathy for what we're going through. And can you meet us at this particular level to help take care of these things? And, you know, it's extremely common, more common than anyone could believe or imagine, how often those particular patterns show themselves, reveal themselves with an initial 5-minute conversation.
Yes.
And it's something that we have to pay more attention to as practitioners. I wish we could spend more time, but, you know, certainly we
right.
usually say that full story gets evolved, you know, when you're in the office talking to our staff and talking to us as well, the doctors. But it's a very, very important piece, and I'm glad you brought that up, and thank you for sharing that part of the story. Helping to understand culture and empathizing. You can't necessarily experience what it is that individual, even in the spectrum with all parents, there's a commonality of certain things, but it's highly individualistic.
It
is. Know, so being a solo child versus a child who's got 3 or 4 siblings, a child who's got 5 or 6 siblings in a large family and has special needs. The entire dynamic, the entire household tends to revolve around that child more often than not.
Right.
So when you're doing your work, do you also work with parents on how to help the other siblings, the other children, adapt and cope with the situation?
Yes. So a lot, in addition to answering who is the client, in many cultures, it's a collectivistic approach. So the client is the entire system. So although the anchor of the system could be the child with special needs, as we know in child development, we also, the parents in that system also need to attune to the needs of all the other kids. And you're right. Typically, at least in my experience, and also, you know, just personally as well, that the child with special needs gets a lot more attention than the other kids. And depending on that birth order as well, depending on the resources, depending on whether it's a single family household, whether there's grandparents raising grandkids. I mean, there's just, like, you know, families in the United States are all different types of families, right? And so knowing who those people are, or a traditional two-parent household with childcare providers. So like the nannies and live-ins and all of that. I mean, there's a whole entire spectrum. However, because sometimes the whole focus has been only on that child, sometimes the aha moment is, so tell me, okay, we've talked a lot about this child. Tell me about this child, the other children. So it's the same methodology. So tell me about this child, tell me about that child. And then you can see how those relationships are with the other kids. And what we typically find, or what I've typically found out, is that some of these kids, because of the nature of the dynamics of their sibling with special needs, they too are also stressed and have a hard time coping, but they internalize a lot of their needs, or they grow up fast because they have to be there for their parent and maybe hold them emotionally, or they want to demonstrate that they don't need to be taken care of, right? And so then we talk about things on how do you honor having that one-on-one time with a child, because this is quite a moving parts game with a family like this. So some of my recommendations are, okay, the same thing. What does the child who does not have special needs what can he or she do, or what do they like to do? So typically you can build in that one-on-one time every single day. So routine, that's the other thing I wanted to say. Routine is huge in any family, but it's even more so with a family with children with special needs, with a child with special needs, because there might be things like where the older sibling has to help with dressing or bathing or things like that. But then at the same time, how can that child be like a child, right? Like, for example, if a child is a teenager and you've tasked your teenager, 16, 17 years old, who's living with you at home, to be the person who bathes or takes care to some capacity from this hour to this hour. But when can they actually be a teenager? When can they be on their phone, talk to their friends, do all of these things that teenagers do, which is typical development. So that becomes a challenge. Typically, what I say to parents is they're like even 15 minutes that their child can do that in a day, and also have a one-on-one with you to touch base about how things are going, how things are feeling, in addition to like maybe family gatherings, meals, church, all of those type of things that are ritualized into the routine, but checking in one-on-one and then having time away. And during COVID, timing, like what I used to do with our two older kids, we'd go and get some ice cream, take a walk, those type of things. Now what I do is I go into our teenager's room and I go, hi, what's going on with you? I've been in meetings all day long. How are things going? I tell my husband, okay, I'm spending this 15 minutes with our other child to touch base, because over time then that mental strain on that child can add up.
Absolutely. And unfortunately, many get lost in the care of the special child, where they're starting to feel rather minimized, rather not paid attention.
Right, they're not paid attention to, and it actually can have an impact on adult relationships, right? That they feel like they have to care for their significant other in not so healthy ways, and enable them for potentially for things that in a typical situation or typical relationship would not be acceptable based on the health of a relationship. And that could lead to things like abuse, violence, all of those type of things, because they've been solely in this caretaking role and can't have that voice or empowerment as a human. So these are all of the things, because there's always consequences, and I don't want to scare any parent or anything where you have to be perfect, because we're not. I mean, we're only human, we're not perfect, but these are just some things to think about, even just one thing to think about to incorporate in the system, or even with educators, right? Considerations of, how is this all affecting? We've given all of these recommendations. How long does it take for you to do all these recommendations at home? How about the other family members? I mean, that usually, that role is usually for the social worker who asks those type of questions. But as a healthcare provider system, those are the things that we can think about, as questions or as something in the back of your mind if they don't already bring it up.
Dr. Perez, how often or do you
Mhm.
actually bring in at some point all the members of the family to talk specifically as a group to the individuals who are not the special needs child, to gain their perspective, their insight, and to talk perhaps about the interactions that occur in the home and what some of the challenges might be around there that are affecting them and therefore indirectly affecting the child with special needs?
Yeah, that's a really great question. It's very complex though, because for me, because I do global consulting with children with special needs, it really depends on the culture. Okay,
Sure.
and a lot of the families that I work with have specific like gender norm hierarchy, and
Yes.
also like what would be the process and who to inform this information to who. So for example, in some families that I work with, the father and the mother are there. However, the father is the person who approves the plan,
Mm-hmm.
and then the mother implements it. But I'm only talking to the mother, right? In the best case Western scenario, everybody is sitting around the table talking about the situation, getting some sort of acknowledgement from the child with special needs. So there's all of these gradations of how it is. Again, back to an earlier point that I made, it's that cultural context, gender context, and really evaluating that and picking up on those cues. I mean, this is like a whole nother topic. I mean, this is really
Mm-hmm.
international psychology. This is a whole nother topic. But that's what makes this ever so fascinating. So it's not necessarily like this process is right or this process is wrong, but if it's not working and those models aren't working, then it's also probably because of the process of informing, communicating, and then following through with a plan. So if you're unaware of those type of things, that's the time when you can, I've asked my clients, what would be an appropriate way? First of all, do you agree with my recommendations? After all of that process of like, tell me about your family, what can you do, and all of these things, and everything is going well, then I go, what are your thoughts? Do you agree with this? And in some cultures, they won't disagree with you because that's just how it is.
Mm-hmm.
But then you have to look at their nonverbals, right? I mean, sometimes it's their nonverbals. It's also like what they're not saying, which I think is really interesting too. So then that becomes, then you have to put on your best foot forward and try to, in your clinical, developmental, educational capacity, make your best educated guess for your next step. But these are all of the questions that someone in my area of expertise gets to ask. And sometimes I don't even ask, I just let them talk, like I don't even call it therapy. I don't even call it any of those things, because those type of words even bring even more stigma to us as parents. So there's all of these things to consider, but yes, I've had all of those. I've also had to ask permission from an elder if this is appropriate. Sometimes the child with special needs can verbalize, but it's inappropriate for them to verbalize their needs to an adult. So that there's all of these complexities as far as how this goes, and then advocating with the school, with that expectation of a school. So it is quite complex, but I think for the purposes here, it's just good to know that there are different models in this process of engagement.
So you brought up the schools and you talked about patterns of behavior and a lot of the kids who are in the spectrum are truly regimented children. Even though they may seem sort of haphazard and excitatory and doing all sorts of things,
Mm-hmm.
they have their expectations and they have their demands.
Yes.
And they make the
It's
demands known deep.
routinized. Yeah, it's routinized and fixated. Yeah.
Absolutely. So now we sit in this COVID situation.
Yeah.
Much of those routines are disrupted. That
Mm-hmm.
child may be going to ABA therapy, they may be going to
Right.
traditional school, they may be going somewhere, and all of a sudden they can't, they
Mm-hmm.
don't. And now
Yes.
they have this sense and they're acting erratically. That throws mom and dad off. The whole
Yes.
family dynamic is off. And it's trying to calm this child, and maybe the child comes and grabs you and moves towards the door because they're expecting to leave. How do you help parents sort of try to reshift or turn that child to kind of help understand that this is more of a different situation and then we're reorganizing, strategizing. That might be even too much to ask for. But what is your process now that we have this regimentation shift because of the
Yes.
COVID periods?
Yes, that's another great question. And I, as you mentioned, being, children on the spectrum or adults on the spectrum, they're all different. So each child, regardless of what their diagnosis is or special needs, they're all unique. And I think that that's the number one thing. Many, there's a lot of information out there on COVID, children with special needs, disabilities. But what I want to stress here is that every child is unique. Okay. Every system is different. So there could be many recommendations from all of these experts, but it may not work for you. And so you have to find what works for your family. Okay. Like what makes your family run, like from day to day, regardless of even the diagnosis, or for example, in this case, autism. So what I've recommended is be kind to yourself. I know these sound very simple. Okay. But it's actually not simple, because if you're a carer, if you've cared for people more hours of the day than not, then how are you kind to yourself, right? Like you are on the last of the list of really, so being kind to yourself, staying calm. I mean, that's really hard with all of this noise going around, because a lot of these kids can feel us. Okay. They can feel our energy. They can feel what's going on. Now, for kids who understand, for example, on the spectrum, what's going on, you need to explain this to them, because, to say, oh, yes, life is the same. It's not the same. And so being honest with your kids based on their developmental level is very important. Okay. So I'm going to give you an example in our family, what happened when we were on lockdown, almost 50 days ago, when we were in shelter in place almost 50 days ago. We quickly said to our child, because routine is very important to him, we said to him, the world is this, because this is how he understands the world. Okay. We said the world is sick. So he understands if you're sick, you can't do stuff. Like, so this is the recommendation I give families, that you have to know how your child processes or understands things. They may understand things through a visual. They may understand things through language and a visual. They may understand things through like squeezing. I mean, there's so many ways of doing that, and that's typically individualized depending on the client. So we said the world is sick, and until everyone has a thumbs up, which they're following directions, because at their school, it's thumbs up or thumbs down or like this. Okay. That's like, okay, you're following directions. However, he's asking why, like, why do I have to follow directions? So we said, okay, the world is sick. And when the world is not, when everyone is like this, then we can go to the stores, restaurants, and things like that, right? So now every day during mealtime is when we check in. Family dinner is when we check in. That's the time when we sort of process some of this stuff. He'll say to me, how is the world feeling today? Okay, that's how. And I go, well, and so that's the other thing. Like we could listen to all the media or whatever, but we need to filter a lot of that out, especially for our own anxiety, and to be able to explain this to our child with special needs and the whole family. So if the whole family can understand from that baseline what the child is understanding, then everyone can understand. And that's the language that we use. And I go, well, the world's is feeling a little better, but not everybody's like this. And then he would say, Luke is this, Luke is not this. So he understands his behavior. He understands a calendar. Okay, so again, for a parent and an educator, you have to know what they can do. So if you understand a calendar, you understand time, you understand the consequences, all of those things then are part of that plan.
Wonderful, wonderful. Any thoughts, any pieces of advice? You've said some very interesting things all along the way. And, we've talked before about time for the kids. And I know what certain parents were thinking out there. It's, wait a minute, you're talking about this wonderful time for me, but there is no other person than me here.
Yes. Yeah.
I'm a single mom. I've got 2 or 3 kids. Forgive me, I'll just talk about it. I'm going through a divorce. My husband's combative. All these things are happening, and now we're in this tight space. I can't get away. I'm ostracized from my family. And folks, this is not an exaggeration. We have situations like this
Yes, we do.
with that we deal with. And it's hard for them. And even today on the news, they're talking about the whole idea of how much drinking alcohol is too
Oh,
much
yeah.
drinking alcohol.
Mm-hmm.
And
Yeah.
people now more towards the depression, the anxiety,
Yes.
the
Mm-hmm.
stress. And in we have a certain kind of a joking euphemism with parents with regard to mommy's happy juice, which on television, I didn't call it that. That
Yeah.
was
Yeah.
TV.
Yeah. Right.
The stressed out mom who imbibes just to try to get settled enough to continue to cope with the rest of her day. And that's when the kids were going to school.
Mm-hmm.
Now we're all bunched up here and we're in this situation. What do you tell folks with regard to that? What is your response? How can we help?
I think, yes. So I know that this is more general, but I'll definitely answer your question. Mr. Wells, if you could just pull up the slide. I have just one slide to just explain a little bit some of this framework. However, to directly answer your question as well, what I tell families is I definitely empathize as best I can. I say, I'm not going through what you're going through. This is very, very important information. But that routine, I know there's and recognizing the chaos, recognizing they're alone, recognizing they're by themselves, right? Creating a routine and scheduling self-care. So if given all of those things that you just said happening with a family, the scheduling of the self-care, and it's not selfish of you, can be 10 minutes. Okay, even if your child is sitting next to you, that you've created in the routine, this is that you and mommy and me, we're going to be quiet, right, for 10 minutes, right? That so that the child, what we know about children who are in chaos or in crisis, or really anybody, the more we know, the more we know and we can control, the better off we feel. Okay, so even knowing, so we have all of these things that we have to do in one day, a routine, scheduling, and also scheduling self-care that actually is healthy for us, and not, I mean, we can say, oh yes, all the self-care is healthy for us, but like drinking a lot and eating a lot and all of these things really aren't, right? But that goes back to being kind to yourself. Like you could just do one small step. So for example, for that family that you said, okay, so what in your schedule, say for example, you have a schedule where you're done, you're done at 7:00 at night, right? Maybe you're working too, you're going through a divorce, you have 3 other kids, there's all of these things. And I do know families like that. And sometimes, although, I do have a partner in crime, my husband, we do have those moments where, so this is the thing, whether you have somebody with you and you can't have anybody coming into the home, right? Many people aren't having childcare people coming in or specialists coming in. Just that 10 minutes or 15 minutes, or what some people also do is they find a space when the child could be occupied or sleeping or something like that, being near them and supervising them, that they use mindfulness. Okay, those practices, even if it means that you're closing your eyes and you're just centering yourself, or you have a mantra, or you have some motivational something, or even every day writing something that is meaningful to you and motivational, some of those things are helpful. But it needs to be scheduled every day, because if it doesn't, if it piles up, then you're not refueling yourself every day. Okay. I mean, the other thing too, which is just way too much information, is you got to pick and choose what COVID information you're going to be listening to and for how long.
Yeah.
You can't be on your phone the whole time, like going, because of the anxiety and feeling of what you have to, again, that's part of the routine. Okay, I am only going to listen to Governor Pritzker's or whatever for this amount of time, and that's it, right? Because that actually can contribute to chaos. If it feels like it's something that is getting out of control, there are your clients that feel like there's other symptoms or things that are coming out of this, like they're drinking too much, or they're feeling more down, or there's explosive outbursts, or there's sense of hopelessness, then that really is a check-in with healthcare providers and the telehealth capacity, And I think that that's where Dr. Mensah, where you could come in with a telehealth or any of your consultations with your patients. The other thing too, I mean, it's really important to me and it's really important to my clients is having a support system like that, just one person. And it typically should not be like your significant other. Because it's too much. It's too many roles going on, right? You can, or maybe you say, at 7:00, let's just run through the day and the schedules and all of that. And then we're not going to talk about it anymore because it's just too much like ongoing issues all the time. Or if you're by yourself or whatever, you need to talk to someone, or maybe you have check-ins. So I actually have check-ins with my friends, like on a Sunday at 1:30, I check in with them. Okay, I call them, we have a group chat or we have a Zoom. Whoever shows up, shows up. Whoever doesn't show up, it's fine. But we're there to check in on each other to make sure we're okay. And that's a safe space. And they're not a therapist, they're not a consultant. It's just, we believe in you and what you're doing, and please tell us how things are going. So, and some of these other things we've talked about as well, but those really small steps and being kind and don't. Many of us parents of children with special needs, especially during this most stressful time, we can really beat ourselves up for not doing all the things that the educators tell us to do, from all the things that we can't. I mean, we're already, there's so many barriers now to what we're doing.
So in many cases, we talk about guilt, right? Supermom, we were the S, and if every single task isn't accomplished, we're in pain at the end of the night, at the end of the week, at the end of the month, at the end of several years for everything that we haven't been able to do. Whereas we'll sit back and say, gosh, Miss So-and-so, Mrs. So-and-so, good for you. Look what you've done. You've done everything humanly possible that's on every single website that has anything to do with spectrum disorders, and you've done it right. Not paying so much attention to the nonsense, but looking at what's really important for your child. But they still feel guilty.
Right. Well, I think, and I think that our society is sort of guilty of that, of not understanding what we go through as parents. So the S really should be, you should be sitting and be present with your child. Because yes, we can go through all these developmental milestones, but if you're not comfortable in your space and go, okay, this is the situation now, we're at home, we're doing all these things. I mean, what some people, and I'm not discounting educators, but however much you can do. I mean, we love our school district and what they do here. They go, whatever you can do, we're all slowly trying to figure this out together, should really be the position that it's okay. You are not a super parent. Nobody's super. Nobody, I mean, you're super people, you're wonderful people, but it's really almost being able to sit there and be okay with, I mean, and it's not okay. I mean, a lot of the things, we've lost so much. So it's not only have we lost whatever our life was before, we're now sitting right with what our life is now with that isolation. So it's a double isolation now. And then what it will look like knowing that our child is going to be behind. There's all of these layers. But the good news here, and I'm an optimist, I'm a strength-based person, is that every little thing that happens, even if the parent survives 1 hour, this is how I operate. 1 hour, we survive, right? We survive 1 hour at home with the dynamics we have here is a blessing. Maybe some people don't see it that way, but that is hope, right? I mean, we have to have hope in all of this, or else we shouldn't. I mean, why would we be talking here if there's no hope for how all of this is going for all of us, actually?
I like that. The opposite of the glass is half empty. It's not, oh gosh, another hour. When am I going to
right?
When are we going to stop this? When can we be unleashed? It's more like, gosh, we did it.
Yeah, but maybe not eating a donut every hour. I mean, or having a drink or something. But I mean, some sort of like, or you could just pat yourself on the back and say, wow, So, I mean, being a parent, educator, I mean, it's like the hardest job you could ever have.
Absolutely. Absolutely. Dr.
Doc-
Perez, that website you showed,
Yeah,
is
APA.
that a place,
Yeah.
the APA website, is
Yeah.
that where people go to get
Yes. Yes.
information
So
about strategy and so forth?
yes, yeah. So there's more information there. Obviously, this because I come from a psychology background. There's many other things from like CDC or whatever, but this gives the thinking, feeling, and behaving from our discipline of psychology, based on the American Psychological Association, which is our professional organization. And if you look up APA COVID-19 and disabilities, you will find it, and there's the link there.
Awesome. Mr. Wells, do we have any questions for Dr. Perez?
just a couple. And so certainly I want to encourage folks, if you do have questions, we're coming up on an hour right now. And Dr. Perez, if you don't mind sticking around an
Of course.
extra
Yeah.
couple of minutes, if
Yes, of
we get
course.
a couple more questions. So we'll encourage you folks, please do, if you've got questions, please do send them in. Just a couple of questions here, but before I get to the first one, Dr. Perez, you've made me need to rethink my donut strategy for.
Well, I mean, that was the first thing I was thinking about. I mean, I was going to say chicken wing, but I mean, that's, but it's ever so yummy.
Absolutely, absolutely. So the one question here that's really interesting, and I almost interrupted the two of you. You were having such a great conversation, but someone asked a question when you were talking about the siblings of children with special needs, and you specifically mentioned older children, who are helping to deal with the younger child that might have special needs. And I've got someone who sent in a question asking, what about those kids, or what about those families where the child with special needs is the oldest child? How do you attend to the needs of a second child and even a third child, who in many cases are more academically and socially advanced than their older sibling, and managing that oldest child dynamic, as it were?
Yeah, that's really a great question. And I think that, again, it really depends on the family and where they want to see. But typically, some of the language that I've given parents, and even when the child is there with me, when they have an older sibling with special needs, and asking the younger child, like, tell me about your brother, your older brother or older sister, then you get a sense of how they perceive their child through the lens of the modeling of the parent. And so some kids say, I don't like my brother. My brother's weird. My brother's strange. My brother's all of these things. I go, okay, tell me about that. Or I'm smarter than my brother. I go, oh, okay. So what are you smarter? I was like, well, I know how to do multiplication. I know how to do this. I know how to do that. Then I turn it around. I go, well, what can your older brother do? He's like, well, he takes up all the time of my mommy or daddy. And I go, well, let's talk about that. Do you like that? I mean, so it then becomes this conversation, and the parent, what's the best case scenario is the parent's there, so that it's not me relaying that information by third hand, right, or second hand to the parent. They can actually hear the child say, but I use different ways of getting that information so that we can then troubleshoot what those next steps will be for those children. But yes, I mean, it's they're not caring, but they wonder, right? As time goes by, their cognitive development is like, well, why isn't my older brother doing all these things? I know another child who is 15 years old, and this 15-year-old person who lives down the street knows how to do X, Y, and Z. How come my brother can't do that? And again, then that if the parent has not explained, being honest and transparent about the child, and not saying words like disabled, retarded, all of those type of things, which some people actually still use, unfortunately, that we draw on all the things that the older sibling can do, what they can't do, and how that impacts that child, the younger child.
It's very interesting too, quite often when we bring the family into the office, and we do have the child with the disability, as you want to call it, disability, the child who is different. is the oldest child. We've often seen the younger children in a very different capacity than most younger children would be, younger siblings. Oftentimes they're very caring of that older
Yeah,
individual,
yeah.
very, very gentle, very attentive. And it never ceases to amaze me, nor does it ever stop giving me that warm fuzzy inside.
Hmm.
To see, I keep having the visual of a little girl. She's literally 2 or 3 years old. Her brother is 5,
Yeah,
and she works with him. She
yes.
takes him, she shows him, very advanced little
Hmm.
girl. She's got that innate caring spirit that is really present in most children. And it's just being displayed so powerfully, especially at that age. They can be just very, very endearing. Yes, in time as they get older, it can also transfer a bit to,
Yeah,
gosh, this is all of our time, all of our energy,
yeah.
and where am I in this dynamic? But it's really, really interesting to see those wonderful aspects to the family when you've got those types of relationships with the kids.
Yeah, it's a totally different dynamic if they're the youngest or the middle. I
Mhm.
mean, just from just birth order in psychology, there's all these qualities of each child, then coupled with a situation in that birth order. So, maybe a pediatrician or someone like that would be able to ask those type of questions. What is it like to be a middle child? What is it like, right? Those type of questions. But yeah, I also see that as well with more of the older siblings with a child who's younger with special needs. The older siblings start potentially get jealous and wonder like, what, okay, yeah, they're the younger child, but you're really spending a lot of time with this child.
We've only got a couple of more questions. So once again, folks, if you've got questions and you want to get them in, now's the time, because we'll be wrapping up shortly, and unless we get more questions that we need to attend to. And one of the 2 questions that we've got left here is actually something that you already began to address, Dr. Perez, and that was just resources. What resources are available out there for parents who are attending to the needs of children with special needs, particularly during this COVID. And you showed us that website on your slide. Is there anything else that
Yeah.
we can point folks
Yeah.
to?
Yeah. I would highly recommend your school district. I mean, the school district has a lot of resources right now. So that's really important because remember, we're talking about supporting communities, and typically a family with a child with special needs utilizes their community first, then like national, right? Like there's Autism Speaks, there's all of these big national Down syndrome, there's like all of these. However, are you really one-on-one with those people in Autism Speaks unless you're really talking to them? But local. So I highly recommend, if you have any children, the educators have a lot of resources. The social worker at the school psychologist would have those resources too. Obviously, your healthcare providers would have those resources. It's all about your relationships with them.
Dr. Mensah, did you want to add anything to that before I get to our last question here?
Nope.
Always want to give you the opportunity. And in fact, the last question is probably much more directed towards you, Dr. Mensah. Probably one of our regular visitors who always wants to keep Mensah Medical at the forefront here, and we always appreciate that. But someone asking specifically, where does chemistry play a role in all of this, and how do we reconcile some of our children that are being treated right now for biochemical disorders as it relates to the things we've been discussing today, attending to the needs of children with special needs. What if some of those special needs are the result of some of the chemistry issues that we're dealing with in their treatment at Mensah Medical?
Well, really, most of the time they are. And that's kind of what we talk about in terms of foundational biochemical underpinnings and what we would call epigenetic expression. So this is where the environment affects genetic expression in genes. It can be different for everybody. But, in times of what we'll call crisis, which is really where we sit right now, anybody has biochemical issues that are no longer kept under wraps. We're all under stress. We're all anxious. We're all moving in these strange directions. There isn't a certain part of the day. And what Dr. Perez said is so important. Don't spend your day listening to every update about the COVID. 99% of the time, it's the same message
Yes.
throughout
It's the
that
same
day.
message. Yeah.
Okay, the same message. So, give yourself, like Dr. Perez said, pick the morning or somewhere mid-morning is probably best. You don't want to wake up with negative news. You don't want to go to bed with negative news. But in treating the chemistry, there are some very simple things that one can do to help for that moment. You're feeling stressed. We talk about a few different products that are out there that are absolutely on the more natural side. They're biochemically directed. And they're not drugs, okay? So you don't have to reach for the Xanax or for the Ambien. You can do things like inositol. Everyone has heard us talk about inositol. For adults, it's, on average a 500, 650 milligram capsule, 1 to 3 times a day. Helps with calming, especially for undermethylated people. If you're on the other side, someone who's overmethylated, you can try GABA Max or GABA. And it's, once again, 1 to 2 capsules twice a day. You can try L-theanine. We don't talk about that one too much. L-THEA, not T, but ANINE. L-theanine also can help individuals with calming. So there's some things that you can do besides reach for the mommy or daddy juice, by the way, to help settle and calm you. And that can be great for a good 8 hours. Look, we can't individually change the world around us at the second. But how you respond to that environment is a different story. That we can help navigate. Those are some of the big boys, big girls that we go to, the inositol, the GABA Max. And look, if your child is being a bit rambunctious and they need to be calmed down, they can take the inositol. They can take those things. It's a family gathering moment. Some of our folks at Mensah Medical will tell you, hey, look, we need to keep a container, a dispenser of this stuff around, okay? For what we go through during the course of the day, everyone's on inositol. So there's some wonderful things that can be done. Even the side of the Dr. Perez and many of our other speakers have talked about with regard to meditation and mindfulness, they all come into play. Look, you're sitting at your desk, you're getting up, you're handling the kids, you can take 30 to 60 seconds just to breathe. You're not going anywhere. You can breathe. And you'd be surprised how that actually changes how you feel about a situation. Close your eyes for a minute. Well, Dr. Mensah, I've got 50,000 things to do. I'm working longer hours because, the boss is this and we're all over the internet, we're all at home. And no, you're working longer hours, but you have more time that you can build in, even if it's just micro moments during the course of the day.
Yes.
When you get up, you stretch, take a minute, then take another minute, then take another minute. Okay. All these things, by the way, change your actual physiology. They change your neurotransmitter response. They start to stimulate the parasympathetic pathways and decrease the fight or flight sympathetic pathways until the next round. So there's a lot we can do from a biochemical perspective and from a physiologic perspective. Some are involving elements like we talked about, inositol, GABA. Others involve really mindfulness. And why am I talking about it? Well, first of all, because we are looking at the complete picture of everyone. Environment, the mind, the brain, these are actually 2 separate things, but related, and the body, and even the foods we eat. Dr. Perez, you brought up, don't reach for that donut. In the words of Homer Simpson, oh, donut. We're beautiful. But what do? They cause your sugar levels to rise. Then they cause you to fall. You get cranky. You're yelling at your spouse. You're chasing after your kids. They want to kill you. You want to strangle them. It's a Bart Simpson moment. Okay. Eat better. Pick the better snacks. Take it down a little bit. So many things we can do with so much time in our hands, right?
Yes.
Absolutely. Absolutely. Well, we don't have any additional questions. Dr. Perez, you had given me a slide to share with your contact information. If you don't mind, I'm going to share that now.
Of course, yes. Thank you again so much for this opportunity to share with all of you.
Absolutely. Let's make sure that we're sharing it here. Do we have it
Yes.
on the whole screen? Here. Okay.
Yes.
So that's Dr. Perez's contact information. And certainly I want to encourage folks, if you didn't have a chance to write down the information that was on that previous slide, everyone please know that we will be posting a video replay of this webinar to our Mensah Medical YouTube channel, and we will also make links to that video available via the Mensah Medical Facebook page. So if you want to go back and replay this and pull down some of this great information that has been shared over the course of this last hour or so, that video will be available to you probably a little bit later on this evening. Certainly, we also encourage you to share this information with your friends and family. And so if they weren't able to join us here live during this broadcast, then certainly let them know about this so that they can find the video and check out the video replay as well. Dr. Mensah, Dr. Perez, any final thoughts before we wrap things up here?
Dr. Perez?
Yes.
Any final thoughts?
No, I don't have any final thoughts. Again, thank you so much for inviting me. And this was a wonderful experience to be able to have a conversation and to hear about what the audience, what's on their minds. So I think that we're very like-minded in our thinking here. And I really do appreciate this time.
Dr. Perez, we want to thank you tremendously as a parent participant, as a professional. We really needed to hear from you. And to all the folks out there, it doesn't matter when you watch this video. This young lady is available to talk to hear from, to get information. What we're all about, especially at this point in time, is support.
Yes.
Look, I'm a molecular scientist. I do whatever I do, but please, we don't provide the kind of support tools that people like Dr. Perez can, okay? That's their strength, that's their forte. And together, we get to perhaps help more than we harm. Not that we harm, but we want to help more than we do, okay? So please, pick up the pen, pick up the phone. If you're in that kind of need, make a phone call. Maybe that's your mindfulness for the day, making that phone call. She'd love to talk to you, and we'd love to have you talk to her. So I want to thank you again, Dr. Perez. Mr. Wells, thank you so much. And everybody out there, hang in there. It's going to be okay.
Thank you, everyone. And don't forget that we will be back again next week. And in fact, Dr. Perez will be joining us next week, along with another guest that's been with us before, Miriam Tafreshi. And they'll be talking a little bit more about a topic that the two of you started to discuss a little bit today, talking about international psychology and some of the cultural differences that impact the way people deal with these stressors that we're facing right now. So join us again next week. Again, you can look for the video replay of this broadcast a little bit later this evening. Thank you for joining us. Thanks to the two of our panelists, and we'll see you all soon. Everyone, stay healthy, stay safe, stay home. We'll talk to you soon.
Thank you. Bye-bye.
Thank you. Bye-bye.